Rhode Island's Developmental Disabilities Community Forum. Monday, November 1st, 2021. Hosted by Advocates in Action Rhode Island. Nothing about us without us.
Hey everyone, welcome to the Rhode Island's Developmental Disability Community Forum. We're really happy that everybody was able to join us today. We want to remind everyone that you are able to ask questions or make comments, but we would ask that you do that in the question and answers box down below. There's like a question and answer. It says Q&A, and then there's another one that says chat, but don't put your questions in the chat. If you can just put them in the Q&A, so we make sure that we see all the questions, because sometimes the chat gets a little out of hand and we're searching for questions in there. We want to make sure that we answer all of your questions today. So
look at the, did you see the chat, Michelle? Look at the chat for a minute.
Oh, look at the chat for a minute. Okay. Oh, I am so sorry. Introduce myself. Deb says, I get so caught up in logistics.
I know, we always do that. We're like,
I'm a logistical person. So my name is Michelle White. I am the Assistant Director of Advocates in Action. And we're hosting this for the Department of Developmental Disabilities. And we're really excited that they keep inviting us back to do this. So we really appreciate that, because we love being a part of what you guys are doing. And I think these forums have been really, really successful in hearing people's questions and hearing their voices. So without further ado, I am going to hand this over to Kevin Savage, the Director of the Department of Developmental Disabilities.
Thanks very much, Michelle. Thank you everyone for attending. I really look forward to these events. And I'm going to tell you, I needed to take a sick day today, so I'm a little under the weather, but I didn't want to miss the opportunity for us to get together today. So I'm going to ask for a little extra help. One thing I didn't do was bring your questions home with me this weekend. So I have my computer, but I didn't get to look at the questions that people graciously sent ahead of time. So what I'm going to ask is, if somebody has the questions in my office, if you could just ask me the questions at the end that I haven't gotten to, because I want to make sure it's that since people took the time to send them ahead of time, that we get to everybody's questions and that they all get answered. I am going to go through the agenda, and I think we will have answered. I looked at the questions last week, so I think that we will have answered quite a few of the questions by the end of the agenda. But what questions we don't get to, if someone could please just ask them, and then I think we will have covered everybody's ahead of time topics. And then whatever questions come up in the Q&A, of course, we'll answer those as well. The first thing on our update agenda is what's called the Caseload Estimating Conference. And that actually came up as part of the consent decree, but I wanted to just address it as a separate topic, because that's a conference that takes place between the department and the legislature, and the department's never participated in it before. And what it is it's a methodology for assisting the department in developing its budget based on the services and the people involved with getting the department services. And Medicaid has participated in it for a number of years. But we've always based our budget solely on what the budget was in the previous year, and then kind of back into it that way. But this is a much more progressive way of budget setting. So we participated in the conference for the first time last week. The conference actually, I think, gets completed this week. And that helps us with how to more appropriately set our budget based on the needs of the consumers involved in the department. So this was our first time out. We're actually hiring 2 individuals to assist us with a more professional approach to caseload estimating. And we're excited about that. We're in the process of interviewing for those positions right now. We should complete them by probably the end of next week. But we're excited about it. It's really an effective way of budget setting, and I think will help us as we move forward in that process, particularly in May, which will be the second time we participate in caseload estimating. So I just wanted you to know that we're moving forward with that, and we're excited about it. The folks at the Office of Management and Budget were very gracious in assisting us through this first caseload estimating budget process last week. So I'm going to go through, we have more to share than usual regarding the consent decree. So I'm going to go through that a little bit today. We had been in the process of litigation regarding the consent decree for the past several months. And there was a court hearing that was scheduled to take place, but we ended up working toward what's came to be called an action plan. We worked on that with the court, through the court monitor, and with the Department of Justice. And so the action plan has several components that will help us in the coming months, really the next 3 years, to work towards specific goals that will get completed by the end of 2024, when the consent decree is scheduled. I think fiscal 2024 is scheduled to come to an end. One of the things that we're working on is a rate revision and methodology process. And we have put out an RFP, a request for proposal, and have accepted bids on that. And we're completing the review of those bids this week, and we'll make a recommendation to purchasing on which bid to select. And that will be done this week. We're hoping to get it done last week, but there was a delay in getting some of the bids over to us. And so the last review of the bids will take place tomorrow, and then we'll make our recommendations. And so that will actually be a pretty involved process. The candidate that accepts the proposal will come in and actually look at our entire rate methodology and revision process, make recommendations to the state, and help us work on revising how we set rates over time, and Medicaid rates, that is, and it will really have a significant impact on how we set rates and next, we are resuming working on the administrative burden process, which has been underway since well over a year, and that will be completed by March 31st of 2022. The work groups will be resume meeting this month, and we're really going to focus the remainder of the time on completing tasks. I think we've done as much of the discussing as we need to do, and we're really going to work now on completing tasks. Brenda Duhamel has been working on a checklist on what tasks need to be done, and the goal of the work groups now will be on getting tasks done, checking them off. We're very close to getting that checklist ready to put on the website so that people can see what the target dates for completing tasks are, and then what tasks are being completed. I think that will be encouraging for people to first know what we're working on, and secondly, see what's actually getting accomplished. There's a statewide, under the action plan, statewide workforce initiative on recruiting and credentialing staff to work with adults with disabilities. There'll be a lot more to be said about that in the coming months, but that is one of the action plan initiatives. And we'll obviously be working with stakeholders on developing that process, and we'll be working with people together on that, so that there's not a lot decided on what that is, but it's something that I think will be exciting to work together on, and kind of building career paths for people who work with adults with disabilities. And I think it will go a long way in terms of stabilizing the workforce and maintaining staff and reducing turnover. We're working on implementing a transition fund. There's an RFP in development to bring on a consultant to help build that process. There's $12 million that's been dedicated to that from the APRA money, ARPA, the basically emergency funding money. I forgot how you say it, APRA money. And I forgot what that stands for, so I hate using acronyms, and I don't remember exactly what they are, but Heather can probably help me with that. But $2 million of that money is actually set aside to support people who self-direct. And so they'll be supporting the creation of a model and a pool of substitutes of staff for people who self-direct. We're also going to work on technical assistance grant process to assist provider agencies to adapt their service models. There's a new technology fund to support adults with disabilities in accessing technology. We're reviewing the transportation needs to increase availability of transportation. And all of these processes will be reviewed and evaluated for their effectiveness by the court monitor who has an evaluation process. That's part of the action plan as well. There were some questions about COVID, and I just first want to clear any misunderstandings about COVID mandates and vaccines. The department, BHDDH, generally does not have mandates for people to be vaccinated. Although most of the staff is vaccinated, there aren't mandates. The Department of Health put out mandates for their staff to be vaccinated, and that does apply to Eleanor Slater Hospital, which is licensed by the Department of Health and managed by BHDDH. But it doesn't apply, for example, to RICLAS, and it does not apply to provider agency staff who are under the licensure of BHDDH. We did certainly consider moving toward mandates, but we gave it a lot of thought, but determined that the impact that it would have on the workforce stability, we just determined that it was not the right time to do that. So we determined not to issue mandates at this time. So I can certainly take questions on that later, but I just wanted that to be clear that there are no mandates under BHDDH licensed facilities. The only issue that applies to the mandate that came out from the Department of Health is if someone's job requires people to have a Department of Health license in order for them to do their job, then the mandate does apply. For example, a registered nurse is mandated to be vaccinated. That's an example. Anybody whose job requires them to have a Department of Health license in order to do their job, the mandate from the Department of Health does apply to that person in that position. So the next thing on the agenda is conflict-free case management, and I'll turn that over to Brenda Duham.
So good afternoon, everyone. Give you a quick update on conflict-free case management. So the stakeholder developed model was created several months ago, and that was shared with EOHHS and Medicaid. Together we went through the proposal and sort of quickly decided that we needed to get some technical assistance. So we've been reaching out. We reached out to CMS and submitted a proposal for technical assistance. And just on Friday, we were approved for that technical assistance that will be provided to us by an organization called New Additions. It's a sort of a consulting group that gets made out of individuals that sort of know our state and that know the kind of work that we're trying to do. So Janine Zlocki and Tasia Stokes, both from NASDs, will be a part of that group, as well as Pro Barnett from Advancing States. So we'll begin our work starting this week. We have a meeting with them to begin talking about the scope of work and how they can best help us. And CMS has approved that. So that's a good sign for us because we want to work as closely as we can with CMS moving forward. Our goal is to have a pilot in place by the summer of 2022, and then hopefully we can have full implementation by the beginning of 2023. So that's our goal. It's a work in progress, and we're really hoping that this technical assistance can help us to get into the weeds and to work out the areas that we still need to work out and begin to work again with stakeholders to develop some of those additional pieces that we hadn't yet developed. I think that's it on conflict-free case management.
Great, thanks, Brenda.
You're welcome.
Tracy Cunningham is going to give us an update on employment.
Thank you. Hi, everybody. Just a brief update about employment and certainly questions after if you have them. What I wanted to do is just, we ended National Disability Employment Awareness Month yesterday. And I use that platform along with our colleagues at ORS to really reach out and have conversations with employers. So in the month of October, I had 3 major discussions with some large employers around the state. And many of you probably were aware, we were able to host a job fair at one of those employers. So both ORS and the DD employment teams are looking to begin employer engagement so we could share those leads with our individuals, certainly who are looking for work, and the providers who support folks to do that. Additionally, in the newsletter, in case you haven't seen it yet, Michelle, thank you, right on cue. This was a little blurb in our newsletter that Anne LeClaire and her team put together, which is wonderful. But this was something we put together in celebration of the National Disability Employment Awareness Month. And this is information and data that we were able to collect relatively quickly through our TheraP system. And I just wanted to point out and celebrate what we know factually, that individuals are working and how long they're working. And so, take a look at this graph and you'll see that 260 people have been working between 1 and 5 years. And then of course, 5 to 9. And we have a person that we can celebrate that's been working over 30 years. So what I wanted to say is that information is wonderful and we're happy to see this, but this really goes back to being able to reach out to our self-directed individuals and make sure we can gather that information so we can celebrate your accomplishments as well. And with that, I'll put a plug in for the Sherlock Employment and Day Survey that's coming out again. Anybody who self-directs will be getting some information in the mail this week, by the end of this week. And if you can take a look at that, there's going to be technical assistance. So for people who are not feeling confident about filling that survey out, both the Sherlock team and the employment team at DD are going to assist with filling out that survey. And that's where we can gather some information about lots of different things that people are doing so we can celebrate those things. Another thing that I wanted to point out was the PSEP 3 project is still continuing to move forward. And as people are starting to fill out and complete their discovery reports, we're finding that people are securing employment. So we have currently 61 people enrolled. There are still vacancies and capacities at 3 out of 4 of our programs. So if people are still interested, please feel free to reach out and let me know, and we can share that information with you. So of the 61 currently enrolled, we have 7 people who have secured employment and secured jobs, 6 people who are actively engaged in or just momentarily going to start their internship, and 8 members who have, 8 individuals who have secured membership at some location that they've identified most recently and have joined as a membership within their community. So those are pretty exciting outcomes for the folks that are in that project. And another thing that we wanted to just put out there is Jay McKay and I are going to host employment office hours. And that will be once a month where we'll have some kind of webinar space where people can just call in during any period of that time, just to call in with any questions or comments or anything they want to discuss or share about for employment. And that will probably come out in the next newsletter, which I understand is coming out every 2 weeks. So look for that in there. But as always, if anybody ever has any questions, both providers, individuals, families, anybody, please feel free to reach out and contact us. That's it for me. If anybody has questions, pop it in there and we can get to that after. Thanks.
Thanks, Tracy. 2 things I want to, one is APRA, Heather texted me, American Recovery Plan Act. So that was that's the funding source that our transition plan money is coming from. So that's what I didn't know earlier, what it stood for. I did want to just quickly mention on that we are working with CMS on getting the funds for that released. They had some questions that we had to answer, so the state has determined not to spend the money until we had full approval from CMS. So we are still working with them on getting full approval. Some of the money, in addition to the transition fund, has been slated to capacity building for the DD system. We recognize that we're not getting living arrangements, particularly in a timely manner. And so we want to really work on building capacity. So I'll have more information on that, I hope, by our next community forum, and certainly in our newsletters, just continue to read those. But I was hoping that we would have full approval by this community forum, but we don't. So I'll continue to update you in the coming months. There have been questions about RICLAS. So there was in our budget proposal last year an initiative to privatize RICLAS. That is no longer part of our initiative. The new governor's administration has taken that off the table. It is not a budget initiative, and it is not going to be a budget initiative going forward. So not only are we not doing that this year, it is not a budget initiative for the foreseeable future. So it has been taken off the table, and there are no plans to put it back on the table. And we have resumed filling space if people want to move into RICLAS. So even though it hadn't been, we hadn't been moving toward privatization in the past, we had anticipated that it would be coming up, and we hadn't been filling vacancies. We are filling vacancies at RICLAS now. And so we're working with families on, when it's an appropriate living arrangement, we're working with families on moving people into RICLAS vacancies. So I just wanted to update people on that. Sheila Coyne has joined the panel, and she's going to give an update on some self-directing initiatives. So I'll turn it over to Sheila.
Thank you, Kevin. Hi. For those of you that don't know me, my name is Sheila Coyne. I am a parent of a young man that self-directs. And I wanted to introduce today the Rhode Island Self-Direct Coalition. Myself and Claudia Lowe are co-founders. She's also a mom. They use self-direction. And I don't know if anyone saw the announcement in the newsletter. I don't want to take up too much time, but we want to provide resources and guidance to individuals and families interested in self-direct services. Self-direction has lots of benefits. My son has done awesome with self-direction, but unfortunately, navigating the system, it can be a challenge. And we just want to have a coalition of everyone from Advocates in Action to BHDDH, the Sherlock. I don't want to leave anyone out. Lots of people are doing good work. And when you self-direct, we tend to be in silos. So we envision an umbrella of all families, individuals come together, share resources, share information, what's working, what's not working. We want to have an employment hub for self-direct staff and support those staff, because we are in a workforce crisis. And unfortunately, while we have individuals that do good work, they're kind of left off on their own as well. So we've already started having like little meet and greets of, they've been called DSPs. We kind of want to get away from, like Kevin said earlier, all these letters, but the support staff. And again, share with them, give them some support, what's working with families, what's not working with families, staff that might have a free Tuesday and a family that fits with them that could pick up hours. There's a lot of cross work amongst us, and we would love for anyone that's interested in being part of the coalition and getting more information, email info, INFO, at risdc.org and join our coalition. And we're going to have monthly meetings. We're going to have monthly meetings for support staff, individuals, families. We're going to talk about what's working, what's not working. BHDDH has tons of new initiatives coming up, and it'll be good just to have a central location where we can all talk about what we like, what we need, and what we could use help with. Thanks.
Great. Thanks, Sheila. Hayward's going to give us an update on transitions.
Good afternoon, everybody. Over the past 3 months, we've continued our work with the Transition Work Group, which is comprised of representatives from the Department of Education, the Office of Rehabilitative Services, various school districts, and several adult service providers. And we are focusing on the last 2 years before school exit. This group has worked with the Sherlock Center to tailor a person-centered thinking training for educators, and has created a transition panel of educators and adult service providers who've worked creatively together on transition planning. That group is going to be sharing their ideas with colleagues and other professionals to help broaden thinking around transition options and collaboration. A transition information letter was crafted and mailed to 60+ youth eligible for DD service who are age 19, continuing with school-funded services and turning 20 between December 1st and August 31st of next year. And that letter provides an into the DDD transition coordinator, the transition link on the BHDDH website, and supports provided through Rhode Island Parent Information Network. Our transition coordinator, Carolee Leach, has been participating in state service presentations given in collaboration with staff from Office of Rehabilitative Services and Department of Education to educators in public, private, and charter schools throughout Rhode Island. And those presentations provide information about application to DDD, IEP participation, and adult services. Each year, presentations are made to staff in over 60 schools across the state. Flow of service roadmap has been created and shared with multiple partners and educational staff for vetting. This roadmap has 2 sections. One is a brief narrative. The other page is a graphic with links to sites holding information on each step of the transition process. So that roadmap is in the final stage of the vetting process, and it will be available in both English and Spanish, and soon to be posted on our transition page on our website. And lastly, I'd just like to share that, we are in the midst of a paradigm shift from transition being about finding an adult service provider to support all of a young person's needs to building a whole life plan with adult service providers, a part of the support network, along with social connections, community resources, and natural supports. And no matter who we are or what stage of life we're in, as we learn about ourselves, what we enjoy, what we need, what our strengths are, the way we think about work, our relationships, how we choose to live, the direction of our lives, we know the development of self-determination skills is a critical component of transition planning. We have ongoing communication with representatives from Department of Education, educators, and Rhode Island Parent Information Network as to the significant impact self-determination skill development has on whole life planning and decision-making as an adult. And as many young adults move towards self-directed services as they leave school, and in light of Sheila's comments, this is really a very timely conversation. So we always welcome suggestions on how to improve transition services. So I'll put my contact information in the chat for anyone who'd like to get a hold of me.
Thanks, Sue. Heather's going to give an update on supported living.
I just have to make one correction though, Kevin, and I'm going to say I was hoping I could blame it on you, but I can't. I have to take the blame. It's actually the American Rescue Act, Plan
okay.
Act. Yes, and I put recovery in there. I don't know if you said recovery, but I thought about it as you were saying it. I'm like, okay, that's not right. So I just want people to know that. But as far as the enhanced stipend, the SLA initiative that we had launched during COVID, we are going to continue that through June of 2022. So I just wanted people to know that as we work on so many changes we're trying to make in our service delivery system, one of the things that we are going to look at is like a whole life SLA. And so we wanted to continue this because we do know that it is working for many individuals, and we want to be able to continue that. So the other update that I also want to give is around legal guardians as paid employees for individuals who are self-directing their services. So got a lot of feedback from the first message that we sent out in the newsletter. And I know that there were many people who were quite concerned about that. And I do have to say that from what I had previously heard, we weren't allowed to do that. I know that other states had been doing it, but or some other states had been doing it. And to my knowledge, they were paying for it through different ways. They weren't necessarily getting a federal match from CMS. But in getting more information, researching it a little bit more, CMS actually had a very great webinar that they did on this subject as well, because there are other states who are looking to move to now get this authority as well to continue to pay legal guardians. We found out that it is permissible. We just need to, again, seek authority to do that. So we will be, as a state, or as a division working with Medicaid to try to get authority from CMS to continue to do that. So I wanted to let people know that and ease people's concerns about that.
So I think that answered about half the questions that we received.
About 3/4.
Yeah. So thank you, Heather. And thanks for looking into that and being responsive to the community on following up on that. That covers everything that I had on the agenda. So the only thing, well, not the only thing, because the main reason that we get together is to hear from the community. So I'm going to turn it over to the community for questions and answers.
In the chat while we were doing that, there were a couple of things just for people to see. One was people had asked for the email address again for the self-directed coalition. And it is info@risdc.org. In the chat, Claire Rosenbaum just shared that the Self-Directed Support Network at Sherlock Center is hosting a dialogue with Heather Mincy from BHDDH. And the date for that is Tuesday, November 9th. The time is 7 to 8:30 p.m. And the link to register is https://bit.ly/2U_AMQZ. Question for Sue Hayward. Typically, service providers have done planning with transitioning youth. As you change your model, who would provide person-centered planning? Where would it be funded?
So person-centered planning really takes place in the transition years while you're in school during your IEP meetings. And then with all the services that you're receiving through school-funded services. So person-centered planning is taking place the entire time that you're in school and transitioning out into adult service. And so as you're shifting into adult service, you have an opportunity to be making connections in the community, maybe nurturing some natural supports that exist, exploring opportunities for employment. And so all of those connections that you're making are part of the person-centered planning. That is then when you move into adult service, if you are eligible for a service through DDD, gets put together into a plan, a whole life plan. And usually that is a plan writer that puts together that plan with you and submits it to DD.
Could we see an example of the model for conflict-free case management?
The stakeholder model that's been developed, we can get that out there on the website.
There was also a question that Ann answered, but just so we see it, the question was, did NESCO bid on this rate revision work, or is that outside their usual expertise? And the answer was, the list of proposers will be available on the Rhode Island State Purchasing website. We cannot comment on the proposers or scoring until it is completed and posted by the State Purchasing Office. If you guys have questions that go in the chat, if you could put them in the question and answers, that would help us. But one of the questions in chat was, after huge effort to vaccinate consumers and workers early last year, wondering if we know what vaccination rate is for workers at agencies.
I'm going to ask Ann that. Do we have that? I think we do actually know that information. Do we know the data on that, Ann?
I don't have it offhand, but we can get it.
Yeah, we can get that and post it.
Related to that is, even though there may be no vaccine mandate, as individual families, just confirming we are not in violation of hiring practices if we mandate vaccines.
Directing, and you want to only hire, yeah, I don't think that's a violation of anything. You can certainly do that.
For Sheila, are you being supported by a group? Is this a funded position? How would this integrate or overlap with the work Sherlock Center is doing? That's from Mary Beth Canoyer.
Currently, we are going for 501c3 status. So far, we have been self-funding. This happened organically. For anyone that knows, my family and I opened a coffee shop for Michael and a Budding Violet gift shop. And we started doing this naturally. DSPs would come in and ask questions, ask for support. didn't know what to do about this, maybe weren't trained in that. So it really happened organically. So right now, I guess you could say I'm funding it. As far as, what was the second?
The second part was, how does this integrate or overlap with the work the Sherlock Center is doing?
Well, I hope it will go hand in hand with what's been happening at Sherlock. There's a listserv that families can follow, that information is shared. I know from personal experience, sometimes those emails can be confusing at best, and sometimes the answer gets lost in translation. And there's sometimes I don't know if it's ever been answered because of the way the emails come across. So we're just hoping to kind of make it a little more intimate. You know, mom can call and say, hey, you know, I'm having this problem, or my FI said this and my friend's FI said that. I mean, there's so much misinformation that we're just hoping if we can have an A to a B, we can cut down on a lot. And I think take out some of the angst of self-directing, because it's a good model.
It sounds really, we're excited about that. Will people be able to view the questions that get asked and see the answers and ideas from others who self-direct?
Yeah, we're hoping to get a lot of that on the website.
Yeah, that's
to
great.
be perfectly honest, this is going as we learn. This isn't something, I think the pandemic kind of brought it forward. There are a lot of families that were isolated and frustrated. It's no one's fault, but you know, we weren't getting a lot of information. If you're self-directed, there was some confusion about even being vaccinated. So we just felt as though we should have a robust group of those of us that self-direct, come together, share our ideas, and build a better model.
Is there any updates on mandates for vaccine as we approach the Biden administration deadline?
I don't have any updates on any mandates today.
And then also, are there plans for booster clinics like Kirkbrey?
No, I don't have any plans for clinics, no.
Another question for Tracy. Any new avenues for job seekers working with agencies to get contacts or clues for employers?
Many providers who are on here would have seen email blasts that are going out. So like I said, both the DED team and the ORS team are working collaboratively. So information will get blasted out. I know Jay McKay also this week, or maybe very late last week, was sending out some email blasts. So that would be another thing. If individuals wanted to get us their email, we can put them on our chain list. We often call on the Sherlock Center to send things out to the self-direct network. And Sheila, if okay with you, I'm going to put you on that list. So as you start to develop your email blasts, that information will be shared. So apologies if you get it numerous times, but I'd rather you get it 5 times than no times.
At the last forum, we learned that CMS still won't allow people to pay for internet as part of their Medicaid-funded plan. Has anything changed since then, or is there anything the state can do so that people can pay for their internet connection with their DD funding?
So I can say that there is a conference Medicaid, I believe it's later this month. And so one of the questions that I wanted to put forth to our Medicaid director who will be attending that conference is Medicaid working with other, departments within the federal government to see what can be done. I do believe that the federal government is trying to work on broadband internet so that it's accessible to a lot more people, but I don't have any details or specifics about that. I just know that that's something that was talked about. So I think, just keep putting the pressure on and keep asking questions about it, because the more they keep hearing, the more they know, and everything that's going on with technology. I know we are definitely not the only state. Other states are always asking about that as well too. But I do know that, right now it is not something CMS is going to fund.
Kim Einlot just put this in the chat, and it's a link. And maybe Kim, you want to turn your camera on and say something if Michelle can give you that power. The link is for fcc.gov/broadband benefits.
Thanks, Kim.
We also have a call-in person that wants to ask a question.
Hi, my name is Heidi Shosted. Can you hear me?
Yes.
Yes.
Hi, I have just a couple of things to say. First of all, I think that it's wonderful that we're all here today. Second of all, I commend BHDDH in not putting forth, I know people are going to hate me, but that's okay. Commend BHDDH on not putting forth COVID vaccine mandations. I think we all have a right to freedom of choice, and I think that we need to respect people's freedom of choice as long as they are being sanitary and respectful of other people. And I do agree that it would greatly create a staff shortage in the future, so I thank you for that at this point. Secondly, I would like to say that there have been a lot of great initiatives with the consent decree and things of that nature, and a lot of great initiatives with transition. I think there needs to be a lot of adults with disabilities considered for these employment positions, also working with the children with transition, and also being on the flesh out committees for conflict-free case management. A lot of times that stuff is overseen by agencies, but the voices of the people with disabilities, as well as the experience that they can provide to others with disabilities and the openness, is not utilized enough. So I hope we think about roles for people with all forms and ages of disabilities to work together both in employment and in some of these flesh out committees.
Heidi, thank you for your input. On the Conflict-Free Case Management Committee, there are adults with disabilities on the committee that reviews and provides input. But if you would like to be a part of that, I would recommend that you send your email to Brenda and she'll get in touch with you.
Could you talk more about the vision of how conflict-free case management would function? Would person-centered planning be embedded in the process, and how do you envision the effect of this model on the ISP development?
Is that referring to conflict-free case management?
It says, could you talk more about the vision of how conflict-free case management would function? So I think it is.
Brenda, do you want to answer that, or would you like me to?
Sure. So it'll be, I think, valuable for you to see the model that the stakeholders have put together. So we will get that up on our website so you can sort of read through there. You know, essentially what conflict-free case management is just that, conflict-free. So the requirements of CMS are that the individuals, the entity, the body that provides person-centered planning and case management is free of conflict, meaning that they are not also a direct service provider. So by the nature of what it is, it will separate out those who provide direct service from those who do the planning and the case management.
Kim is going to explain the website that she just shared about broadband.
I'll be brief because honestly, I'm not an expert on this. I'm just aware of the benefit that exists. And so I provided a link to a website that really does explain that this is a benefit that eligible households can receive. And you'll see if you click on that link that it could be something like a discount of up to $50 per month towards broadband service. So that's what it's about. Oh, there it is. So that's what you'll find. You'll see a little video on the right there of a person explaining the broadband benefit. And that's really all I know about it. So that's what I have to say about it.
Well, thank you.
Kim.
All of these links and stuff will be in the recording when you watch this on the website. We'll post them there so you can see it spelled out on the screen. Any other questions? No questions, really. That means, all right then.
Hopefully that means that our agenda covered what we needed to cover.
And that
Just
means maybe you
thanks,
can go
everybody.
rest, Kevin, because you sound sick.
Thanks everybody for coming out. Thanks for the questions that you sent in that helped us put our agenda together. It was wonderful coming out and getting together. I appreciate the group's strong participation and involvement in this forum. And I don't know if we'll get together until January, but have great holidays. I hope you had a nice holiday.
Feel better.
Again, thank you.
Bye.
Bye, everyone.
Contact Rhode Island DD Services at phone 401-462-3421, email bhddh.askdd@bhddh.ri.gov. View the questions and answers from today's forum. Learn more about the topics discussed and sign up for the DD Updates newsletter at www.bhddh.ri.gov/developmental-disabilities. Watch this recording again at www.advocatesinaction.org/DD Community Forums. Remember, the person in the center is you.